Welcome to A State of Sight. I'm Isaac Porter, and this is your update in ophthalmology and eye care from Raleigh. Today I would like to explain the scleral fixation technique for lens implantation. Some people will call this a glued lens implant or glued IOL technique, but really the glue doesn't have anything to do with the lens holding itself in place, so I prefer the scleral fixation. And what this is a great new technique for putting in a lens implant when there's not good support inside the eye to hold the lens. Now, this was popularized by Dr. Amar Agarwal from India. He's a great surgeon and a great teacher to help spread the word about this technique. And the way that it works, when there is not good support inside the eye, the arms of the lens implant that we call haptics can be brought outside the eye and then put underneath these pockets that we create in the sclera, or the white part of the eyeball. When we do this, we do it exactly 180 degrees apart from each other, and then we can bring out one and then tuck it into a pocket, and then bring out the other one and tuck it into a pocket. This has been proven to be a very effective and safe technique, and the lens looks really stable in this position. It has some advantages over some of the other techniques where the lens can be centered very well, and it can also be very nice and flat inside the eye, so it doesn't have tilt that can cause trouble with the vision. Now, after the lens is put in like that, glue is used to seal the pockets down and also to bring the conjunctiva up, which is the thin skin that covers over the surface of the white part of the eye. This glue probably dissolves in the first week, maybe 2 weeks, and really doesn't do anything for the long-term support of the lens. Now, patients that may need this could have been ones that had complicated cataract surgery where the lens couldn't be put in at the time of surgery, or it could be patients that had multiple operations, including retina surgery, and they may have had complications with a lens implant inside their eye from before, or the lens may have had to be removed from their eye, so it could be placed with this technique. The alternatives for this, if you look at some of the other options, could be an anterior chamber lens implant that's put in front of the iris, or a lens implant that's put in with sutures or stitches that could be stitched to the iris or to the sclera. Now, since this is a newer technique, we don't have a good long-term follow-up data on it, but it looks like it may be better than these other techniques, especially for the long term. So if you have any questions about this new operation, please post. We'll be happy to answer them, and hopefully see you again soon next time on A State of Sight.